So, hello and welcome to the online physiotherapy open day. I'm so sorry that I can't be there in person with you, but I'm so very pleased that you've taken the time to join in this online session and find a little bit more out about the BSc Honours in Physiotherapy here at Wrexham University. So I hope to introduce you to all the team members. My name is Julie Wilkins and I'm the Programme Lead and the Professional Lead for Physio at Wrexham Glyndŵr. I'll talk you through an overview of the physiotherapy programme and how it differs from other programmes that are available. I'll then explain the funding options. We're in Wales, so it's a little bit different from England and Scotland, the application process, and then you'll also have an opportunity to have a question and answer session live with me through a different forum. So I'd like you to watch this online video from the Physiotherapy Vision for UK Physiotherapy. And I want you just to take the time to look at the different physiotherapists and all the different service users that they're helping, their age range, and some of the problems that they're trying to overcome. So you will have seen from that video that physiotherapy isn't just about treating service users with musculoskeletal problems. It's about a wide range of people from cradle to grave, different ages, different presentations. So I hope that's piqued your interest about all the different ways in which you can help once you start to get into the physiotherapy profession. So this is the team, that's me at the top. And then my colleague Maddie Nicholson, who is a lecturer who specialises in musculoskeletal and motivational interviewing, and also the placement lead. A little bit more about placements later. And then my other colleague Karen Cartwright, who is a lecturer who specialises in neurology and learning difficulties, and is also the assessment lead. The programme is a 3-year full-time programme. We have a September intake. The intake for this year is now finished and closed. So our next intake will be September 2021. You'll attend university 3 days every week. You'll also do full-time placements. In the first year, you'll go on placement for 3 weeks. In the second year, you'll have 2 6-week placements. And then finally, in the third year, you'll have a 6 and a 7-week placement. Physiotherapy is probably one of the hardest degrees you'll ever do. There is a lot of self-directed learning. And I think it's only fair that potential applicants understand the size, the enormity of the challenge that they're going to take. For every hour I do with you in class, I'll expect you to do another 10 hours of your own learning to really learn the skills, the theory and the knowledge that you need to be an effective physiotherapy after 3 years. It's a university that's in Wales, and we do have a Welsh delivery focus. So the physiotherapists that we're going to turn you into are going to be most suited to the Welsh health system of integrated care. However, it doesn't stop you being an effective physio in England and overseas. You will have Welsh language lessons. They are mandatory. They're not assessed, but they are mandatory. And some of your colleagues who are on the course will be first language Welsh students, and they'll help to teach us all to improve our Welsh. The other great thing about the course at Wrexham Glyndŵr is that it's an interprofessional education approach. So you'll be doing a lot of work with the social workers, with the occupational therapies, and also with your nursing colleagues. So you learn together because you're going to practice together. Just a little note on costs. We pay for your student CSP membership. We pay for your uniforms. If you're on one of the commissioned places, you'll also get some travel costs and some accommodation costs, but a little bit more about that later. So the focus is on employability. The focus is taking you in year one, and by year three, turning you into a resilient and resourceful physiotherapist who understands normal anatomy, normal physiology, normal aging, normal development. And then we gradually introduce you to assessment, evaluation, treatment, and start to get you to understand what happens when the body doesn't work as it should do, when people get chronic conditions. And then gradually, as we take you into your third year, we get you to understand complexity of how patients present, complexity of where you might practice, and we get you ready to be an autonomous practitioner. The modules in year one are, we have 2 foundations modules, which are big chunky 40 credit modules where you learn about musculoskeletal, neurology, cardiorespiratory, and start to think about how you'd assess, how you'd take a history from a patient, how you would apply that history to the normal physiology and anatomy of those systems. We teach you how to learn, which is research 1. So we teach you how to look at a research paper and make sense of it. We also support you to go on your first placement and start to introduce the concepts of what it is to be a professional. In level 2, you start to learn about what happens when things go wrong with the cardiorespiratory, neurology and musculoskeletal system, and how to start to treat patients and evaluate whether those treatments that you've done have been effective. We then get you to start in research 2 to decide what your dissertation focus is going to be on, and we do the literature review in preparation for the dissertation, and you go on to 2 6-week placements. In level 6, first thing we do in the third year is get the last 2 placements out of the way so that you can then focus on your dissertation and a couple of other modules about management of the complex patient, and also getting you ready to be leaders in the health service and getting you ready to respond and look at innovations in practice. As a physio, our assessment needs to be appropriate to being a physio. So we don't just do essays and word-based assessments. We have vivas, we have OSCEs. So you do practical assessments because we believe that that's most beneficial to the work you're going to be doing. We have some in-class tests, you do a group poster presentation, and you build up a really extensive portfolio of continuing professional development from the placements that you attend. Now, if you're interested in coming to Glyndŵr and you think that the focus of the curriculum suits you, we'll need to look for a pass in English and Maths at GCSE and 120 UCAS points, which is approximately 3 Bs at A-level, or an appropriate access course, then you can talk to me in detail about that in our Q&A and ask whether the qualifications that you've got I feel would be appropriate for the course. We need you to have studied in the last 5 years, but please don't see this as a barrier. Here at Wrexham Glyndŵr University, there are lots of opportunities to do some short courses at level 4 that will give you that recent study. I run a course called An Introduction to Physiotherapy Profession that runs 2 or 3 times throughout the year. It's a 20 credit module at level 4, and you can come and join in on that, find out a little bit more about physio, get your study up to date. And that's a really nice way of seeing if Glyndŵr's for you and whether physio's for you. We want you to have had some relevant experience. It doesn't matter whether it's voluntary or paid. And we understand here at Wrexham Glyndŵr that it can be really difficult to get a placement in physiotherapy. So what we look for is placements in where you understand the role of the physio, where you might be working in a different area, but it gives you the insight that you've given something of yourself to others, that you've gone above and beyond to achieve a place on our course. And all the way through, we want you to have an insight. Just the fact that you've taken the time to join in on this session means that you're showing interest, and it will help you in your application process. Here are some ideas about how to get a little bit more insight into the role. The Chartered Society of Physio have a really great website where you can get a good idea of all the different ways in which physios work and support people. You can follow physios on Twitter, you can go to other taster days, you can look at some of the academic journals, so look at YouTube. So don't be afraid of looking at some of the social media and getting a real sense of what it is to be a physio. I think it's worth saying at Glyndŵr the class sizes are small. So for the 2021 intake, there'll be 30 students. So if you want a hands-on, very personal approach to your education at university, Glyndŵr might be for you. If you want an experience where you can hide at the back of the class and be one of many people, I'm thinking that Glyndŵr might not be the right place. There are lots of fabulous, fantastic physiotherapy courses throughout the UK with different emphasis, different class sizes, and have a really good look around and make sure you're matching what your style and what will get the best out of your education for you with the university and the course. So this year, for 2020, the Welsh Government have funded 25 places, and there is 5 self-funding places. At the minute, we believe that that's what's going to happen in 2021, but we'll get confirmation of that towards the end of this year. So basically, with the funded places, you do not have any tuition fees. You get a means-tested bursary. You get support with placement costs. The only thing you have to do is work in Wales for 2 years post-completion. You need to link with the student funding and welfare team in the university to get some advice about that, because it's not always the right option for everybody. If you are self-funding, the fees are currently £9,000 per year. We'll still pay for your membership at the CSP. We'll still pay for your uniforms, but you won't get any support with travel and placement costs. This is a screenshot of a leaflet that the NHS Wales bursary scheme can give, and you'll see that there's a email address, a website address, sorry, at the bottom, and you can get lots more information about some of the terms and conditions and what it would mean for you and your family should you take up one of the bursary places. So we only take applications through UCAS, so have a look at the UCAS application. What we need from you is you need in your personal statement, if you're going to get shortlisted, relate the whole statement to physio, demonstrate your insight and your commitment, relate your experience and voluntary work to the profession of physio. So if your voluntary work wasn't with a physio, explain why the voluntary work that maybe you did in a special school or maybe you did in an older person's care home, explain why that's relevant to your application to physiotherapy. The interviews for September 2021 will probably take place in the February, March of that year. All shortlisted students get interviewed, and we have a group activity and multiple mini interviews. So you basically spend 10 minutes with a series of people, and you go around different stations, and we're looking at your communication skills, we're looking at why you want to be a physio. We want to make sure that you understand what you're taking on with a physiotherapy degree. So we ask you questions. So we practice. If you're successful, you'll come on and you'll do practical sessions practicing on each other. So part of the reality of study is feeling comfortable to sit there in your shorts or feeling comfortable to sit there in your underwear, just your top underwear, while we're looking at shoulders and back. So that's a really important part of study. The next part is the placements. The placements are full time. They could be up to 1 hour away from where you reside. So, when you're on placements, it's a full time, it's a long day, and we just need to make sure that you understand that you've got to do these 1,000 hours. We sort out where you go, so you don't have to worry about that, but you have to do 1,000 hours, otherwise you're not eligible to get the degree and you're not eligible to register with the Health and Care Professions Council. The other really important part is that you have to have 80% attendance at university. So your attendance is monitored, and if you don't achieve that, you cannot get the degree. So everybody has a score during interview, so all the scores from the stations are added up, and that helps us to identify who are going to be offered the places. Apologies. After the interviews, we let you know whether you've got a funded place or a self-funded place, or whether you're on our reserve list. If we reject you, we will explain why if you want the feedback. So if you want to know what went wrong, how you could improve for the future, we'll give you that honest feedback to help you develop and grow, because it's unusual for us not want to see somebody come back. All offers will be conditional. They'll be conditional to an enhanced DBS, so you have that check. It's really important that if you've got something on your DBS, early on in engaging with us at Glyndŵr, you start to talk to us about that, so we can look at whether it's viable for you to gain a place on the course. You have to have occupational health clearance. We'll be looking at 2 references, one from an academic source and one as a character reference. And of course, achievement of your academic requirements is another really important part of the conditional offer. If you'd like to talk to me in more detail, obviously there's the Q&A sessions that will be coming up today. But my email is there. There's my office number, but at the minute it'll be ringing for a very long time because we're all working from home. So best if you just drop me an email and I can talk you through any of the things you'd like to know about the course. The admissions team you can get via the website, and there's the email address for the funding should you want to get any more information about the funding. So thank you for your time today. I hope you've enjoyed the presentation. Normally on an open day we do an interactive, we do a mini teach. We can't do that today, and hopefully as soon as the open days are back as face-to-face, you'll come and meet me in person. We can get to know each other a little bit better, and you can work out whether Wrexham Glyndŵr's the right place for you to come and study physiotherapy. So hope you all stay safe and well over the coming weeks, and I look forward to meeting you in the future. Thank you for your time.